सहना भवतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै ॐ शान्ति शान्ति शान्तिः. Good afternoon, everyone. So wherever you are, good afternoon and good evening for some of you. Let's get started with session 9 with Mukundji and Rakiji. Today we would be going over a couple of sessions here. We have 3 topics to cover. One is aging and age-related topics. The first one is aging 200. Cognitive vitality and dementia. This is led by Rakiji and co-hosted by Mukundji. This is about the cognitive vitality and dementia. And the second topic we will be having is aging 300, which is the fundamentals of elder care and geriatrics. This is hosted by Dr. Mukundji. And the last one is 400, aging 400 class, which is also hosted by Dr. Mukundji. And this is how the caregivers, care for caregivers is a topic. And we should be discussing all of those here. And as we are progressing, this has become a very common problem, I guess, in most of our families as we have aging parents. So hopefully this is very informative for all of you. It has been a great honor to listen into this class from my last class. So let's get So today's class session is from 1 to 1:15. We have the resident learning objectives of each of the sessions. And from 1:15 to 2:15, Dr. Rakiji will be going over the cognitive vitality and dementia session. And after that, 2:15 to 2:20, we have a small break, followed by aging 300 class with elder care and geriatrics by Dr. Mukundji. Sorry. And after that, we have a little longer break, 3:20 to 3:40. We have the break, a second break. And from 3:40, we'll be going over aging 400 for caregivers with Dr. Mukundji. And after that, if you have any questions, we'll discuss the homework objectives, followed by closing prayers. Any questions or any concerns, anybody? Okay. I will quickly go over lesson number 200, lesson objectives. And this is the bulletin description is Mayo Clinic says the cognitive vitality is essential to quality and survival in old age. With normal aging, cognitive changes such as slowed speed of processing are common. Cognitive decline is not inevitable but can occur in individuals with genetic predispositions. Conditions such as diabetes, hypertension, hyperlipidemia also contribute to cognitive decline and onset of dementia in older people, as do lifestyle factors such as smoking and excessive alcohol intake. Lifestyle factors such as lifelong learning, mental and physical exercise, continuing social engagement, stress reduction, and proper nutrition may be important factors in promoting cognitive vitality in older adults. The course will provide an overview of this topic and practical techniques to maintain cognitive vitality and recognize the warning signs of dementia. And we have Rakiji, who is an MD as a physician. She's been practicing, specializes in family medicine, geriatrics, and hospice and palliative care. After completing her residency and geriatrics fellowship in Chicago at Loyola University, she will move back to the Bay Area to complete her second fellowship in hospice and palliative medicine at Stanford University. She has an extensive experience working as palliative care physician and hospice medical director with a non-profit hospice agency. She currently divides her time working as hospice medical director and palliative care physician at Kaiser Redwood City. Outside of her work, she likes to spend time with her geriatric boxer dog, energetic 3-year-old son, and her husband with whom she competes as a gardener. So good to know that she has been losing ever since her husband started working from home during the COVID. Yeah. So the course here provides an overview of cognition, educates scholars on the role of brain health for successful aging, informs scholars about dementia and its complex path, describe caregiver training and crisis of caregiving for dementia patients, describe multiple ways to maintain the brain health, understand the evidence-based approach to cognition and brain health, provide a curated list of resources.
So, welcome everybody to the first CHT session for 2022. Happy New Year to all of you. And while this is continues to be a strange year for us through the pandemic, I'm hoping that this year at least we'll kind of see the decline and of the pandemic. It's never going to go away. I don't think it'll be endemic in our society, but hopefully we can return to some measure of normalcy in the future. But in the meantime, we will continue to do our best in all the things we do. And part of that is for the HCI to bring to you the best we can in the CHT program. I wanted to put the today's talks in context in the overall program, and I want to start with what I always do with each of my sessions is to tell you folks, the scholars and others listening in, that you should approach each of these lectures with what have I learned from it? How am I going to use it in my own life? And how am I going to use this information in service to the community? And if we are not able to answer those questions, you should be asking us, what have I missed? Help me answer those questions. So with in the CHT curriculum, a significant element of it is knowledge-based. And so the 5 courses in the aging series are designed to give you that knowledge, that information that'll help you understand yourself better and help yourself, help your family, and help your community better. You recall in my first CHT Sunday session, I think back in session 3, I gave a lecture on healthy aging, where we talked about what healthy aging means in terms of quality of life, in terms of being able to function, that we could live the best life we can live the best life we can, regardless of the state of our health, if we follow certain guidelines and looking after our body, mind, and spirit, finding sense of purpose in life, and so on and so forth. So that kind of talked about aging in an overall way and kind of giving ourselves a, how shall I put it, a goal for us to strive towards, in terms of being as healthy as we can, both personally and as a community. Today's lectures, the 3 of them, plus there's one more, Aging 500, that comes later on in the year, are designed to give you information where we go beyond that aspiration of living the best life we can, but understand that at some point we are going to deal with reality. We all have to, as we age, deal with some reality in our lives. And so to give us that knowledge base as well as that perspective, so that we can do the best we can for ourselves, and for our family. And the courses are designed to give you a certain piece of information about what happens as we age, what can happen as we age, and how we can deal with it. And together with aging, we link caregiving because um, at some point, all of us are either going to need care or receive care, or at this point are actually either needing or receiving care from others, right? So aging and age-related issues and caregiving are kind of linked fairly strongly. So you'll find some measure of both topics being covered in these. So as Anita ji pointed out, Raki ji is going to talk to us about cognitive vitality and um, uh, the effects of what happens when that's affected, dementia, Alzheimer's, and so on and so forth, and how to deal with that. I'm going to then, in the next lecture, talk to you a little bit about elder care and geriatrics. Now, I have to be careful because we're talking in front of an experienced geriatrician, but I'll do my best not um, uh, to misspeak. And if I do, Rakiji is going to be here to correct me and guide you folks well. So I'm going to talk about elder care, geriatrics, and some element of care, the requirements of caregiving from the perspective view of the patient, right? And then the third and final talk for today is going to be about caregiving for the caregiver. And that's a whole new topic which requires actually a lot of attention because most of us as caregivers ignore that, which is to our detriment and to our family's detriment. We need to understand what are the things we need to do from a caregiver's perspective when dealing with health issues. So those are the three topics we'll cover today. Anita ji has given you the background to what Ragi ji is and does, but I just wanted to add a couple of words. Raki ji is a good friend of Sukham and good friend of HCI. She believes in the visions and goals of both organizations, and we're so happy that she's able to take the time from her busy practice to be able to contribute her knowledge and her wisdom and her experience to us in the lectures. You'll be seeing her once again later on in the year when she talks about the medical needs of the people over the magic number of 50, right? Medical needs of 50 plus. But today she's going to talk to us about her core discipline, which is geriatrics. And from that perspective, she's going um, to describe to us what cognition is, what cognitive vitality is, and how to deal with issues related to dementia. And she'll explain dementia and Alzheimer's and those kinds of things to us. I'm really happy to say Rakiji is a good friend of ours and very happy to have her on board here. And look forward, Rakiji, to your talking to us today. So thank you so much.
Good afternoon, everyone, and welcome and I hope you enjoy this talk about cognitive vitality and dementia. Anita ji did go over the course objectives, and I can kind of go over it again. It's talking a little bit about what cognition is, what's the role of brain health, and we'll talk a little bit about what are some of the strategies for successful aging. Talk about little tips about caregiver training, especially when they are in a crisis moment, taking care of patients who have dementia at different stages. Different ways to maintain our brain health as we age. And at the end of the topic, there'll be some references to where I got this information about. So, aging, it's not a disease. It's a process, and we have the largest number of older adults worldwide. The average U.S. life expectancy back in the 1950s was about 64 years. As you progress, things with more development in medicine and with new inventions, It went up to about 79 in 2015. But the latest census back in 2020, it went down by 3 years. So it's now about 77.3 years. I feel that, we're still in the middle of an epidemic and, pandemic, and we'll see how this eventually does affect our overall life expectancy. Because as all of you know, with the mass number of deaths we've had because of COVID, a big majority of patients were in from the nursing home. So I feel it will eventually definitely affect the US life expectancy. The reasons for different, our life expectancy is different, like immunization, medication invention, technology, better care, different facilities, advancement in medical health. It's not an unstoppable process, but it's variable. Essentially, if I had to put it, it's an interactive process, aging, of lifelong influences. Things like our hereditary, the environment that we are in. Our culture plays a big role in how we age. The diet, being which is influenced by our culture, where we come from, exercise, any illnesses, past or present, and many other factors. All of these accumulate, and together they affect our aging process. And that's why it's a little bit more complicated, because when you're in your 20s or 30s, or even for as children, it's easier to anticipate and how we're going to grow, how a child is going to go, or as teenagers, what stages or milestones we'll achieve. But as we get older, the aging process, it becomes a little bit more individual. So one person may age right differently from the other, and simply because it's aging is affected by so many of these factors that I mentioned. So this topic, and then followed by a couple of more discussions or topics by Dr. Mukund, we'll be talking about what is successful aging. Essentially, it's having a healthy body and a sound mind, and finding the right balance for each person. This is more like a Q&A, or some myths that are out there in the community, where, and I just everyone can already see the answers. So the general myth is that everyone over 65 is going to have Alzheimer's disease or dementia, which is not the case. There's there's a general notion that, as you get older, your level of intelligence is going to go down, which is again not true. Is dementia a part of normal aging? No. Sorry, so dementia is part of face. As we get older, are we going to have more acute conditions and more chronic health conditions? Yes. Everything, more the acute things transition to becoming more chronic things. For example, if one has heart disease or lung disease, most of these medical issues become, chronic issues, which the process is about how to manage them in a good and effective way, so that we can successfully age. That's the goal that I usually have for most of my patients, even if they have simple things like if they have high blood pressure. The goal is not, I know, and I try to educate them that, it's not going to be possible to, completely cure the hypertension, but how we can manage it successfully. Generally, people, younger people sometimes feel that after retirement, people either become ill or soon. I think retirement is also now a very moving target. Some people want to retire earlier if their circumstances allow them to, and want to explore and do other things. And some people like working for a longer period of time. And for them, retirement is not really a thing that they look forward to, and they want to continue working for as long as they can. Also, as we get older, we become more spiritual. So, what are the ingredients that you want to look for a cognitive vitality? It's focusing on three things, which I call them as three M's: your mind, your mobility, and managing your money. Having a good positive outlook can definitely help people as we age. It helps them, continue to contribute in a meaningful way to the community in whatever work they may do. It could be as simple as, doing, volunteering, or doing something, at the school or the library, or maybe as something more complex. For example, Anitaji mentioned her father-in-law was a surgeon, and he was able to contribute back to the community and work for such a long time. And the money, or the managing the money part, is important because as we age, all of us, I feel, we need to make a very conscious effort to plan, and have a backup plan, or a plan to handle our health issues that may possibly come up in the future. So nothing should be coming as a surprise, because as we all know, we all are aging and we are in different stages. So having a plan would be really helpful. And also for family acting as caregivers for their parents, or for other relatives, or for friends, I think having a support group for them. So what are the most common risk factors that we see for aging? Chronic diseases like hypertension, diabetes, arthritis, heart disease, kidney disease. The risk factors where, where I've said self-management. Sometimes, when we get diagnosed with this, and then we kind of settle into a routine, not being proactive about our medications, or the treatment that we're getting, and sometimes resorting to what a lot of my some of a lot of my older patients tend to do is self-managing their medications. That kind of is a very fine line, and it can sometimes be a little worrisome for the physicians, because then you kind of run into other problems related with self-managing your own medications. Cognitive problems or dementia, which we'll talk about a little bit more. As we age, some risk factors are when we see, if someone is having a fall, if they're having to go to the hospital again and again, hospitalizations. So whenever I have a patient who's had falls, or for some reason or the other, they're having to to go to the hospital, every few months, or they've had to go to the emergency room, that's a big red flag for me that, we need to step back and take a better look at what their overall care is, trying to assess their psychosocial situation, trying to assess what's going on medically with them, with their medications, and trying to also assess, the plan or that I am offering as a physician, does it match or does it work for them in their home environment? Because sometimes as physicians we can offer so many things, but we have to make a conscious effort, especially for aging patients, that what's being offered, does it work for their care? Are they willing to take it? Do they have any challenges regarding those medications? You commonly see too many medications, not having good access to health care, a lower health literacy, the living alone or the social isolation. I think that's been such a big challenge. I have seen it so much, at least in the last year and a half, for aging patients being alone, not having the support of children, or for family members or even caregivers. That's been a huge impact. This is just a picture view of how we are as we age. So I've been using this word cognition. If I had to really define it, it's a process of perceiving knowledge, being able to use that knowledge for problem solving, using our judgment and reasoning. It includes language and memory. So when we age, there's a notion that, oh, we are going to lose, there's going to be a decline in everything. As we age, the changes in memory are more of like the process or the speed which we can think, our attention span, and our reaction time. So those are things which are normal physiological changes that we see as we age. The biggest three changes that happen when we are aging are, apart from different levels which happens at different levels, at the cellular level, at the tissue level, but the three organs that are affected the most is our heart, our lungs, and our kidneys. Essentially, what's happening is, if I had to put it in really simple words, is, for example, if someone at the age of 20, their heart is strong enough and to be able to pump 20 times the blood that one would require to be able to stay alive. But after the age of 30, the reserves, or the ability for the heart to pump as well, it keeps going down by 1% each year. So when we're aging, the reserves for our heart, our lungs, and our kidneys, they start going down. So that's when, if you have heart disease, because your reserves are going down with age, that's when you have, when you hear patients, oh, they had a really bad episode of heart failure and they had to go to the hospital, or they took a certain medicine for an infection and it really affected their kidneys. It's the ability, because the reserves have gone down, the ability of the body to bounce back from any little setback. It could be an infection, or it could be as severe thing as cancer. So the reserve, because of the reserves have gone down, the body is having a harder time to get back to its previous baseline. So what is not a part of normal aging? Your memory loss, the short-term memory loss. If you see or if you hear about friends or family members, if they start having changes in their ability to plan or execute things, poor judgment, finding words, and they're talking and they have difficulty finding words. Good examples are, when I am talking to my patients, I try to ask them simple things like, if it's a couple, trying to ask them who's doing most of the chores in the house, and if there's been a change in that. If the either spouse was doing managing the bills, and suddenly they're having difficulty managing the bills, that's a good red flag. Something has changed. Or they were driving and they went for groceries, they got lost, they couldn't figure out the way back home. Or not being as social, like someone who was very social and would go out for different activities, if they have a certain hobby that they've followed for their entire life, and now suddenly they're not as engaged, they're kind of withdrawing from it, or they not making not making it for those kind of events. Changes in mood and personality. Someone who's not been as short tempered, but suddenly they become very short and they get triggered by simple things or word questions. Those are simple cues to look out for. Now again, these are subtle signs to ask or to look out for. I do it as for my patients, and when you're talking about this for the scholars, these are things to look out for uh, when you're concerned that someone may be may have cognitive impairment. This is more of just of a visual cue of our brain. There are three parts: the amygdala, which processes our emotions. The cortex it kind of is responsible for all our senses and all our sensations. The hippocampus is which keeps or stores all our long-term memory. So as physicians, we very commonly use a term called as mild cognitive impairment. I would say it's an intermediate stage between normal aging and versus someone who has dementia. For anyone to have dementia and to be diagnosed with it, they may be someone may have the warning signs, but for anyone to be diagnosed with dementia, they need to have neurophysiological testing. So as a physician, I am very careful of using the term dementia loosely for any of the patients I see in the clinic, because of what I said earlier on. There's a certain, once you get associated with that term, it's very hard for families to kind of disassociate that term. So I try to be very careful, when I'm saying that, and I want to be really sure that someone actually has dementia. If there are concerns that the family is bringing up by certain events, like we talked about, they're no longer able to manage their finances, they got lost, they're unable to follow or do simple chores that they were able to do, that make me at least concerned that they may have cognitive impairment, that I may put down in their medical chart, but I would definitely want them to be seen by a neurophysiologist before I say that they definitely have dementia. There are some simple screening tools. One of them is called like a mini mental status. It's a set of questions that we can go through with a person when we see them in the clinic. It kind of gives us an overview of if the concerns that we have about cognitive impairment are high, and then refer them for the next step of proper evaluation and diagnosis. But like I said, I always try to be extra careful of what we're putting down, because I wouldn't want someone who doesn't have dementia to be labeled with that.
So, Rocky ji, can I interrupt for
Yes.
a second? So, is this more like anything related to genetic, like this Alzheimer's and dementia, or is it more like anybody can get it kind of a thing?
Right now, the verdict is still out. Like I said, all these factors that play a role in aging, yes, they do have a role. Um, the more the role of genetics becomes more predominant in cases where we have seen dementia diagnosed in really early age stages, like for someone in the early 50s, or 60, or even like I would say in the 50s. That's
Okay.
when you want to look out and you want to do any, if there is any genetic screening, we want to look at that. But in general, there are several factors that may contribute for someone getting dementia versus one not getting it.
Okay.
For example, then there in families of siblings, one may get it and the other may not.
Mm. And if they need to like kind of pre-diagnose, like, so you're saying that they can make appointments with a neurologist or neurophysician, right?
The neurophysiologist, yes.
Physiologist. Okay.
So a neurophysiologist is they do a very detailed screening where they go over several questions and templates. They get a very detailed history. So that's how we make a final diagnosis, because there are really no scans or tests to find a good way. So the screening is really the way to do it.
Okay. Thank you.
So going back to dementia, it's a general decline in our mental ability.
Actually, sorry to interrupt. Are you okay with taking questions during your talk?
Yes, I'm okay.
There are two people who have raised hands. I think Nishta ji and then Rita ji. So.
Oh yes. Sorry about that. Go ahead, Rita ji.
I think Nishta ji was first.
Okay, sure. Hi, Nishta ji.
Thank you. So what I wanted to find out, my mom had Alzheimer's and dementia. What are the chances of of inheriting it? I mean, what is the percentage? And secondly, I heard there is some blood test that can be done where they're looking for some marker for dementia. Is that accurate?
So to answer your first question, and I may have to go back and look into a little bit more detail. I don't know the exact percentage of what the chances of of one inheriting it from their parents is. For the blood markers, I know that whenever if there's a concern that they may have dementia, they always want to, they do run the whole list of blood tests to make sure that anything that is reversible is not being missed out. If there's a specific marker, I'm not aware of it. Do you happen to know the name of the blood test, or?
I actually do, but I don't have it in front of me. I'll look it up. Thank you, though.
That'll be helpful for me to know as well.
Okay.
And Rita ji, you had a question for me? Or if Geeta is...
Okay. Rakesh ji, I can. Yes, it's a Geeta.
Hi, Geeta.
Namaste, Rakesh ji. Actually, yes, it's a very interesting and at the same time very scary also. So how can we, is there any tools to differentiate between dementia and Alzheimer's without diagnosing? And is there any remedies or is there any activities we can reduce the symptoms?
Yeah. So going back to, the first question was, and is there any way of diagnosing it?
That's what I was asking question, Rita. That's Rita. And I think then she jumped and I stopped.
Okay, sorry.
That's okay. That's okay. That's quite okay. Yeah, that's what my question was, like, how can you diagnose? Because sometimes we, with the aging, we forgot the names and we forgot something and all kind of things. So how can we diagnose, like, okay, what is the first steps to find out, like, okay, you have a dementia or Alzheimer or whatever? Is there any blood test regular when you go for checkup with the physician? He can let you know, and then you have to go with the neuropsychologist or neurologist or something like that. Or how do you first steps? What is your first step?
So the first step, unfortunately, we don't do like for some kind of diseases where you do screening blood test. We don't have something like that for dementia. Okay. Usually, usually it's the partner, the caregiver, or the spouse or the family members who will bring up certain changes that they have noticed in their loved ones, and that usually is a good way or a trigger for me as a physician to find out more as to what changes have they noticed, and if that has been a consistent pattern. All of us sometimes forget words, names, and but if that's happening regularly, if that's consistently going on, and we feel that the memory has been declining over the past several months to years, and there's a pattern to it, it's not a one-off event, that usually gives us a good cue as to maybe we need to look into it a little bit more. As a geriatrician, we do some simple screening questions or tools. It's called as a mini mental test. Now, that's a very crude way of figuring out or assessing if someone does have cognitive impairment, or if this is different from normal aging. When we do move to that step, and we do notice that yes, they do have cognitive impairment, and probably it's a little bit more severe based on the screening test and the score that they get, then we refer patients or their caregivers, and we talk about moving on to the next step of having a more formal diagnosis.
Okay, then you can go with the neuropsychologist.
Yeah, so they do a more detailed screening test. It's all clinical based. There are really no scans or blood tests to say that this person has dementia versus this does not. Even the what they talk about, like noticing plaques and tangles, is in postmortem when they did an autopsy of the brains in patients who had dementia. those were the changes that they noticed. But these are all post, after they had passed away. Right
Oh,
now, there are really no good diagnostics, tools, in terms of like tests, like PET scans or CT scans that will be able to, pick up all of those things. When I talked about the blood test, they want to make sure. A lot of times, low vitamin B12 levels, if someone has Parkinson's, if they have a history of alcoholism, those can also contribute to the overall, picture of dementia. And those patients may have dementia, but other than, just having it normal, as part of, someone got dementia, there could be other trigger factors, like if someone has Parkinson's. Some Parkinson's patients go on to develop dementia. Some people who have a long-standing history of alcoholism, they go on to develop dementia. So there are different trigger factors that could also be, causing to the eventual diagnosis of dementia.
thank you. Thank you so much.
There, there are a lot of medications that are started for patients who have dementia at different stages, preferably at the early stages. There is no cure for it. It's mostly managing the symptoms that they may have from dementia. A good example would be there's a colleague of mine whose father recently got diagnosed with Lewy body dementia. And after the diagnosis, the focus for my colleague has been mostly around managing the environment. They have, her father was also put on some medications, but the goal of those medications was more to manage the symptoms that he on and off on and on some bad days has as a result of the dementia. It does not really, the studies are mixed, that it does slow down the process, but there's not been really good evidence that, oh, it makes a huge impact, and it does not reverse the disease process for sure.
Okay.
Geeta ji, your question is answered too.
Yes, thanks.
Okay, thank you.
So this is what I talked about, a normal brain versus someone who has Alzheimer's. You notice more what we typically call as amyloid plaques or tangles. And there's a difference in what, someone who has a normal brain versus someone, with Alzheimer's disease. There's overall shrinkage in the overall volume of the brain, in addition to all of the tangles and the plaques that they see on autopsy. So
I'm sorry. Can I have one more question?
sure.
In that case, meditation and everything can help. If you see like the brain shrink, I saw this brain shrink. The meditation or yoga or anything like that help in the beginning stage?
That's a very good question, and I'll be talking about a study that was done in Finland, and I'll be addressing those. So I'll be coming to those things.
Okay, thank you.
So, what are the changes or what causes that? There's a damage of the nerve cells in the brain. It could occur in several areas, and depending on where it's been affected most, different patients with dementia have different symptoms. Some have more behavioral symptoms, some have more physical symptoms. So, depending on what area of the brain got affected, the symptoms may be more pronounced in one person versus the other. So I think this is what we all are kind of wanting to know and talk about, as to what are some of the ways to protect our brain, and what's going to be good for our heart and brain, as we get older. So the finger study, it was a study done in Finland. It was one of the largest studies that was done to figure out and work on ways to review what kind of interventions that people adopted at different stages of their as they were aging, helped prevent cognitive impairment and disability. And they gave it a short term name for finger. So these are some of the findings. that help. Routine screening. I think the underlying message for all of these, things that will help us with healthy aging is, what I like to say is, we try to, even when you're younger, is, when you're trying to learn a new habit, is being consistent. So I think all of these screening, all of these tips and tools for healthy aging, I think the underlying message is consistency. Routine screening, having frequent and regular, blood pressure checkups, making sure if you have diabetes, you're getting your A1C checked. If you have any abnormal heart rhythms, following up with your cardiologist. Managing any, if someone is does like the alcohol, managing, making sure that it's limited. um, One of the most common things that especially older patients run into is over medication and the drug interactions. So in addition to talking about other things about their care, I always, as a rule, like to review all the medications that my patients are on. And I always also make sure that I ask them any over the counter medications, because nowadays, all of us take supplements in some shape or form, and those supplements definitely do affect the medications. And the way that they affect it is being, affecting the overall absorption and the efficacy of some medicines. And some supplements do it more than others. So I always want to make sure that, what supplements are my patients taking. If someone has any vision issues or hearing issues, to make sure that, they have been evaluated for it. And, also screening regularly for depression, especially in the society that we live in, where it's more, uh, you know, it's more single families, and parents are not living with their kids. We want to make sure that there's no, social isolation or other mental health issues. And lately, the awareness about mental health is, coming more and more. So we don't want to ignore that part. I'm going to take a pause and see if anyone has any questions.
Hello, Hari Om. I do have a question if you have the time.
Yes, please.
Namaste, my name is Maha. I apologize for not having my video on. I'm in India currently, actually, very relevantly to this topic, taking care of my dad who's had a respiratory distress syndrome. But anyways, with respect to your slides, if we can go back a couple back, we use the term Alzheimer's and also dementia. Can you clarify if dementia is the umbrella field and Alzheimer's is a kind of dementia, and there's terms like Lewy body and all that? Yeah, that slide, exactly. Thank you. Could you put in perspective how these terms relate to each other, please?
So dementia, you could put it as the umbrella. That's very correct. And the different types of dementia that I mentioned are, there's Alzheimer's, there's vascular, there could be Lewy body dementia, dementia related to someone, if someone may have Parkinson's. Those are the big ones that we see. If someone has had a big stroke, and after a stroke, if we start seeing a lot of cognitive changes, then they could be classified under vascular dementia. Lewy body dementia is a type of dementia which we commonly see in patients who have Parkinson's, and then they start having cognitive changes. Anyone who's had a long-standing history of alcoholism, and we always want to get that part of the social history, and they develop dementia. It could be, we could put it as, it's likely related to the alcoholism. And Alzheimer's is a separate one, a separate type of dementia. So dementia is the big broad term. And then if you're able to find a cause that may have led to them being to having dementia, and if we are able to find that cause, whether it's vascular or Parkinson's or alcoholism or any other, then we're able to kind of subdivide or subname it, or put it as under vascular Alzheimer's or Lewy body. Does that help answer your question?
Yes, absolutely. So did you say vascular Alzheimer's? So would Alzheimer's be
Vascular is
a...
different and Alzheimer's is different. Vascular is
Okay.
usually seen in patients who have a history of, strokes. And after the strokes, if they've had changes in their cognition, then we usually say that it's likely related to their stroke. And then it gets classified under vascular dementia because of the, related to their poor blood supply, which led, or, circulation issues in their brain.
Okay, that clarifies it. Thank you so much.
So I think coming to exercise, it overall helps decrease our disability, helps preserve independence and maintaining our balance. The studies, the finger studies show that there was a 40% reduced risk of dementia because there was an increase in the gray matter, and the cells, as we aged, they were able to continue with the cell repair process, which is one of the things that gets slowed down as we age. There was, increased cognitive reserve, or which we talked about, like, having decreased reserves as we age. So exercise helped with that. And usually they recommend about 30 minutes, each day, or about 150 minutes, exercise each week. This was the general, recommendation. So to answer your question, about the meditation, yes, I think it would help. Are there good studies that I'm aware of that, followed patients closely just with the meditation? I'm not aware of a specific study, but I think in regards to meditation, it helps us have a more balanced, approach, or a mental approach towards issues or challenges in daily life. And I think that would help with the cognitive, maintaining or continuing with our cognitive health as we age. So coming to sleep, they say, the study talked about, having, people, have a set, or try to follow a regular pattern or a regular routine, getting up and sleeping at the same time, avoiding daytime naps. It's more to aligned with the fact that, as we age, with taking naps, I think what it does, it affects our sleep cycle or sleep quality at nighttime. And that's why for aging patients, and specifically for patients who have cognitive impairment, we recommend that, they try to follow as much as possible for caregivers to help them follow a routine, because a routine helps them add some stability to their daily lifestyle. So it avoids the bad or the unpleasant days. But also to understand that despite everything, if someone has cognitive impairment or dementia, despite our best efforts, there are still going to be some bad days and still going to be some, not so pleasant moments. But how to manage those unpleasant moments or bad days? I think we've all seen it, regardless of the fact if you're aging or not. Like if you're sleep deprived, it affects our mood. It affects our overall health. It affects our work quality. So healthy eating. Nowadays, there are different kind of diets. I think you turn a corner and there's a new diet that's in the news nowadays. So I'd like to hear if someone is following a specific diet amongst all of you. One of the most more popularly diets is the DASH diet. It was initially started off by helping, patients who had hypertension, helping, to manage their blood pressure. But the study noted that, it overall reduced the risk of Alzheimer's dementia by 35%. And this diet is mostly it's It's plant-based. It focuses on nuts and vegetables and beans. So it was more of a plant-based diet, which I think is again now in a lot of popularity. Um, I'd want to take a pause over here and see if anyone is following a specific kind of diet and how that has affected them. Or we can, if someone is willing to share, no pressure.
If you can hear me, I just wanted to say that all of these various diets seem to be more of a flavor of the month kind of activity, and we all get drawn to it. I too was at some stage. I think eventually I've come to realize a balanced diet, a little bit of everything, and controlled eating as we age and exercise are the best ways, at least for me and for my family.
Yeah. Thank you for sharing, Ushaji.
You're welcome.
My goal for this year was to, I've had some people who have turned vegan and they talk about the benefits. I don't think I'm at that point yet, but my goal was to have more plant vegetables in my diet and less of animal protein, and then eventually see where I land this year.
Yes, the vegetarian, the green leafy vegetable and all kind of things in the diet make your stomach lighter.
Yes.
So that's how they become more active, and you become more productive also, and more energetic also, because when your stomach is light, you always feel more energetic.
That's true. You don't have that food slump.
Bulky, yeah. When you fry food and everything is like, so with aging, you don't have that much digestion power, and it just stuck there, in the stomach, and you become so lazy.
Yeah. I see Ratna and Rita ji have a question or a comment.
No, that's a comment I was, you asked me.
Okay.
Yeah.
Yeah, even I had a comment here, like for vegan, I'm trying to be vegan as much as possible, except like milk products. Sometimes I end up drinking coffee with milk. So it's hard to completely take it out. But whole of last year, I was a vegan and I could see my energy level was very high. I believed it was because by being vegan, it removes a lot of toxins in the body. The toxins which make you more lethargic or makes you more prone to diseases. So those are removed. So that is the one big advantage I saw from being vegan.
Yeah. And did you have to go through a big lifestyle change when you decided to go vegan last year?
Lifestyle change, meaning I had to get adjusted to eat a lot more fresh vegetables, buy a lot more vegetables, and discipline myself in doing more of those.
Yeah.
That was a lifestyle change. Otherwise, I felt like it was not that hard as I thought it would be. Yeah.
Okay.
But we stayed home. We didn't party more. So it was easier.
Yeah. We'll have to I think then you may just have to do more parties after COVID is over. So to help people get into the vegan lifestyle.
True. Yeah.
Rita ji, I see your hand is up. I was wondering.
Oh, no.
Okay.
Maybe I can add the comment in this one.
Okay.
Yeah, I agree 100%. I'm doing the same thing, but I'm not that strict like, some people. I have my friend, it says, no, I'm vegan. So they don't eat anything. And I always believe that if you don't eat your, somewhere, if you have to eat your stomach or anything is not going to digest, and it's going to be a big problem. So what I do, like, if I go out somewhere, I'm not that strict, but at my home, I don't make it.
Right.
So, and that really helps me too, So with the digestion problem, I don't have any kind of problem. If I go, definitely will eat less, because, you don't feel like to eat like you used to eat before. Your portion is going to be less. But again, your stomach is not going to be like so used to with only one kind of food.
That's true.
You will adjust everywhere.
Yeah. Seema ji, I do see your hand up.
Yeah, namaste. With due respect to all the people who follow, vegan diet, etc., there's no right and wrong about it. But I do think that it is not the product itself which is the problem, the vegan problem, meaning the vegan products like milk, cheese, paneer, whatever, yogurt, right? Historically, since ages, it has been considered in Indian diet as a healthy options. But the issue really is how these vegan products have evolved and being produced in America, which is like a factory production and not a natural production. Yeah. And that's the reason. So the product itself is not an issue. How it is produced in America is an issue, which is now forcing people or whatever to give up the natural product and go for artificially produced products like almond milk, silk, what is it called? Soya milk, and many other, which is multi-billion-dollar industry, So that's all. It's just a comment. Again, with due respect, everybody has preferences, but I believe that if naturally produced milk and homemade paneer with no chemicals, no preservative in it, is any day more healthy than any kind of processed food. So that's what it is.
Yeah. Thank you for sharing your thoughts, and you bring up a very good point. And without being biased towards any of the other cultures, I feel all of us coming from India, our culture and our diet gives us so many options that everyone can adapt and it into their individual lifestyles and make it work. I think that's the beauty of of Indian food. So going back to our discussion, again continuing along on the same topic of socializing and learning. When we socialize, it helps us build meaningful relationships long term with friends, with neighbors. Learning, acquiring any learning a new language, a new skill. What that does for our brain is it helps activate memory, reasoning. So it's a way of working the brain. That's why you always see people saying that they're going to learn a new skill, they're going to learn painting, or they're going to learn a musical instrument. So just different ways of getting your brain to work, and do its share of exercise. Preventing injury, preventing falls, making sure that we are evaluated regularly and are able to drive safely, being watchful of infections, and something to that we may see, especially in older patients, which is called as delirium. Delirium is a waxing and waning of our mental alertedness. So if someone has an infection, especially if they're older patients, you may see that because of the infection they may have a period where they're very confused for a certain number of days or a certain part of the day, and then the rest of the day they're very lucid, they can have a good conversation, they're not confused at all. And this is what is called as delirium, which we see very commonly in especially older patients. And then again, going back to my point, when someone is when an older patient is in the hospital for whatever reason and they've been hospitalized for quite some time, if as a physician I'm seeing that there's some confusion, and the family sometimes thinks, oh, is this the onset of dementia? That's when I take some time to educate them that if there were no warning signs or red flags before they got hospitalized or before they had this triggering event that made them come to the hospital, more than likely it's delirium. And before we actually go ahead and say that, oh, this patient has dementia, we want them to give their body a chance to heal and recover and see if the confusion resolves. Because for as simple as it may just be delirium and it may not be dementia. So being very mindful of, where and on whom we use the word dementia, because sometimes as physicians, and I think I take responsibility for that, that sometimes when physicians use a term loosely, families associate that, that term for their loved ones. And I try to be very cautious of when I'm actually using the word dementia for my patients. And in those circumstances, I may say that there is concern of cognitive impairment, but I would not use the term dementia. So just to kind of get an overview of what the risk factors are, like we talked about, any heart-related diseases, diabetes, which affects, different major organs in different ways, strokes, mental health related issues like depression, any brain related injuries, either traumatic or it could have been, related to strokes, some medications. All the medications that we take don't come without side effects, so we always want to make sure that the medicines that we are on, they're evaluated regularly, their doses are the right ones. So having, that discussion with your doctors on an ongoing regular basis, should be part of your annual physical exam. Poor diets, excess of anything like we talked about, excess of alcohol or smoking, sleep problems, and little social activity of being alone. So all of these are big risk factors which could overall affect the cognitive health for all of us as we age. And to summarize it, healthy aging will start with healthy behaviors earlier in life, and trying to make small changes that we can incorporate into our lifestyle without going taking extreme measures. So this I think is a good visual picture which kind of helps us if I had to divide, our lifespan into 3 phases. So the phase 1 is where we have the opportunity to, to be able to follow a healthy lifestyle, adopt good, habits, so that we are trying to prevent any chronic diseases. In a stage where we do eventually end up with some kind of chronic disease related to the heart, lungs, or kidneys, that is kind of is a start of some problems and how we can best manage it. Again, with having regular follow-up with our physicians, managing our medications, and ongoing lifestyle changes to best manage the chronic problems or the chronic diseases we may have. When these diseases are not managed well, we end up in acute crisis situations, either getting hospitalized or emergency rooms, and or frequent doctor's visits, and leading to a physical decline. When that eventually progresses, we start seeing changes, especially for the older population, when they are no longer able to manage in their home, they're needing extra care, going to nursing homes or facilities where they can provide 24/7 care. And that's when we kind of getting to a stage of making hard decisions and what one would want at the end of their life. So this is a toolkit, I think, which applies to all of us, regardless of whatever stage we are in our life right now. Talking about home safety, proactively planning for our care, making sure that our financial and legal matters, the ones that need to be in place, those are taken care of. And through all of this, continuing to trying to manage our health with screening, with regular exercise and nutrition, making sure of having a good community support, social engagement, medications that we need to if we are on any, if you have any chronic diseases. So these were some of the links for where I gathered my information from. There are some books at the bottom. I'm sure everyone has heard about the book by Dr. One Day, It's Being Mortal. I've read this one. I haven't read the others. I have read a little bit of about the 36 Hour a Day. It gives good information, especially for caregivers who are taking care of patients or their loved ones who have dementia. I haven't read the others, but if someone has, I'd like to get their input on it. So this slide talks more about how we can support families who are taking care of their loved ones who have dementia, making sure that any reversible causes that someone might have from dementia, with the dementia, like infections, are the big ones that we see in dementia patients. Neuropsych testing that we talked about, learning, there are a lot of support groups for dementia. Overall, working on a daily schedule, making sure that the home is safety proof, helping with resources for like adult daycare centers or senior centers, making sure they have a legal power of attorney, they have a medical surrogate decision maker, making their affairs or their finances are in order, and doing this early at the onset of the diagnosis, and helping the family or the spouse plan to help with caregiver, because I think being a caregiver for a family member who has dementia, it takes a big toll on them. And the goal is to try and support them through this process. What I mentioned earlier, anyone who has dementia, the goal is to overall have more good days and less bad days or rough days. Some of the things to follow is having a daily structure, calm environment, and avoiding triggers. If they get fixated on something, to agree and try to redirect, but not try to, say no and disagree, because that will just trigger the whole situation. Making sure they have their safety, issues have been addressed at home. And again, simple things like photographs, music, reminiscence, where you talk about old and good memories. Those are really good therapies in their overall mental health for patients who have dementia. So those are some of the things that we try to do. That is the end of my presentation, and I'd like to hear comments or questions that.
Angie, I wanted to ask you, I actually volunteered with the Alzheimer's Association here, and I work, and I also volunteer with the Indian senior citizens in this area. And I wanted to know how difficult, I mean, I don't know if up north you guys have it or not, but how difficult is it to get funding, to get some housing approved for senior citizens? Like, the Chinese community has a whole community here, and it's only for their senior citizens. How difficult is it to create something like that? And the other comment that you made about music and so on, it's very, very helpful to do music as well as art. And I will post in that WhatsApp group a movie that was done. It's amazing. I've been trying to find somebody to translate it into Hindi or Gujarati or some of the other languages, and it's very difficult. But they do show how the Alzheimer's, these different triggers and cues for the family to watch out for. So I will post that in the WhatsApp group. But if you could just answer if you guys have done anything up north with any senior housing for the Indian community.
I'm not aware of if there's some community, housing projects for our Indian aging population. Unless Mukunji, you have something to add, honestly. not that I know of.
There have been a couple of efforts to do that for Indian-based families, but nothing really has materialized yet. It's primarily economics and other considerations that have thwarted that.
Yeah.
But I think Florida and New Jersey, they do have it. But for some reason, I don't know, California, we've not been able to do anything like that, which it would be awesome if we could, maybe put together our minds and do something like that. It's a great need.
You
Perhaps we can talk about this at the end of the session if we have time. We can
Yes, sorry.
Yeah.
So everybody, let's resume the class at 2:35. If everybody's okay with that.
Yes.
Okay.
Anitaji,
Thank you.
can you stop sharing your screen?
Yeah, I will stop sharing my screen.
Thank you.
I just wanted to share one small story before I say bye to all of you. This is early when I just moved to the US and I was doing my residency training in Chicago. And I had gone to a Macy's store in Chicago with my aunt and uncle. They both are physicians, and they really wanted me to meet this person. And this was a 92-year-old lady. Her name was Nora. This was back in 2009. She was working at Macy's and she was a saleswoman.
Oh, wow.
And she was sharp as a tack. She was so well dressed, and she was so she was so pleasant and very interactive, and that left a very big impression on me. And I was like, okay, I hope I get close to of what she is, at least half of what she is. But she was amazing, and at 92 she was working full time.
Yeah.
That's a wonderful story that we can all aspire to reach for, right, Rakiji?
Yes, and it does, do it in our own little ways. It doesn't have to be like Nora.
Thanks again on behalf of all of us for a wonderful lecture and a stimulating discussion from you, Rakiji, as always.